Hey everyone, welcome to NHC's Historic Neighborhoods Task Force October webinar this October 31st, and happy Halloween. Please enjoy all of these clip art images I have thrown into this week's presentation. I hope you uh, enjoying this spooky season. Really quick, we're going to run through a agenda for today's webinar. We have a great two presenters joining us today, but we'll start briefly with some introductions and then go through some updates on behalf of the National Housing Conference. Before we have a presentation by Tanya Torno from the Housing Authority of Riverside County and Steve Berg from the National Alliance to End Homelessness. I'll give them a bit more of an introduction in a couple minutes, but first I would like to turn everyone's attention to our upcoming event here at NHC, the Solutions for Affordable Housing convening. This convening is happening on December 3rd and 4th here in Washington, D.C. at the National Press Club. And early bird registration ends Friday, November 8th. So that is looking at about a week from now. So definitely make sure to register before prices go up. This is going to be a great opportunity to learn more about the various policy issues that we are tackling here at NHC, which is going to include a panel on ending homelessness, which ties very well into today's presentation. So make sure to check out the NHC website for more information on registering for that event. Additionally, we have some more upcoming webinars that we'd like to get to note before we dive into this one. The first one that's upcoming is a ELA webinar. So ELA is NHC's Emerging Leaders of Affordable Housing group. So this is a group for individuals ages 30 and under who are in the housing industry and want to learn more about the industry, as well as meet other folks within the industry. So if you or if folks in your staff in your workplace are qualified to be an ELA member and are interested in learning more about what we're going to be doing with that group, this is going to be our first webinar of a series of educational webinars, and it's going to be a discussion on racial justice and community development and how those two things are interwoven into and how we need to work to continue to connect those things in the work that we're doing in these spaces. The presentation are going to be two great ELA members, Latana Obadozi from the DC LISC office and Olivia Barrows from the LIF office. The other webinar that we're having upcoming is the next Restoring Neighborhoods webinar, which will be happening in November. The exact date is still to be announced, but it's going to be a presentation on multifamily affordable housing by Bob Simpson from Fannie Mae. So look out for both of those webinars and more information about those coming out soon. Next, I'd like to turn it over to Tristan Bro, the Director of Policy here at the National Housing Conference.
Well, thank you, Nathan, and thank you all for joining this webinar, and definitely thanks to Tanya and Steve for taking the time to educate us on what we call at NHC very much an indictment on anything affordable housing, the failure of affordable housing when we look at the homeless population in this country, definitely as it relates to different sectors. And so happy to have the two of them participate in this webinar. Some of the updates from NHC, Nathan has already articulated, and which is good. So I won't keep up too much of the time because I know it's a very, very important conversation to have. But I will emphasize that our Solutions for Affordable Housing convening, again, we have two per year, one in the spring for housing communications, and the other one which is coming up on December 3rd and 4th, which are Solutions for Affordable Housing. We try to identify key solutions to address the issues of housing in this country. A lot of conferences, we talk to ourselves and we look at the numbers and we look at the problem and we try to figure out how to work together to figure out ways to address it, but we don't really have a convening that kind of highlights directly the solutions. So that's what we try to establish here at NHC. And so we do look forward to the participation of so many people who can come into DC, and we're also very happy to have our second annual Advocacy Day. We're taking housing to the hill, hashtag housing to the hill, on December the 4th, and advocating for the expansion of affordable housing and how we can increase minority home ownership as well. And so looking forward to the conversation today as we are having a great conversation on ending homelessness. We know that housing is a continuum. And so when you have less homeowners, you have more renters. And when you have more renters, you have higher rents. And when you have higher rents, you have the probability of having a larger homeless population. So with that, I'll turn it back over to Nathan and look forward to listening today.
Great, thanks, Tristan. Just a few technical notes before we jump into things. A link to view the presentation that we're having right now and downloaded slides will be emailed to everyone who registered. So for those folks who want more of the information from the slides, those will be sent out afterwards. Also, we really want this to be a conversation. We're kind of limited, obviously. We don't want to, and we can't open up the line to everyone to ask questions when they have them. But we do want this to be a dialogue, and we would love for you all to engage as much as possible. So if you do have questions, if you submit them into that questions box on your little toolbar, I will be able to see all of them, and we're going to have a question and answer portion at the end of the webinar. So please ask any questions you have there, and we'll try to get to as many of them as possible. And then finally, if you need any help with the webinar software itself, you can visit this website down here, and it will direct you to some technical help. And now, so before I turn it over to our two presenters, I want to just give a brief background on the both of them. Tanya Torno is the Principal Development Specialist at the Housing Authority of the County of Riverside. She brings over 11 years of experience in social services, both in the nonprofit and public sector, into her role at the Housing Authority, which is placed on the Special Programs team. And this team is dedicated to assisting households at risk of or experiencing homelessness and other special populations. So we're really excited to have her expertise here. And Steve Berg is the Vice President of Programs and Policy at the National Alliance to End Homelessness. Steve specializes in employment, economic development, human services, and how those issues intersect with housing. Prior to his time at the Alliance, Steve worked on state-level welfare reform, employment issues for the Center on Budget and Policy Priorities, and also has 14 years of experience as a legal services attorney in California and Connecticut, focused on housing, family integrity, and other issues. So we're really excited to have these two wonderful presenters and all of their experience here with us today. So with that, I am going to turn it over to Steve.
All right, great, thanks. Thank you, Nathan and Tristan, for having us here. And I'm going to talk a little bit about just sort of a general overview of federal policy issues about homelessness, and then we're going to hear about how things are going in California, and then I'll be back to talk about a couple of key advocacy issues right now. So let's see. A couple of things about homelessness in the United States, and just to give people a general guideline. You can see the numbers. There's about 500,000 people are homeless every night in the United States in shelters and on the streets. There's an additional number of people who you would consider homeless, who are sleeping in apartments and houses or bouncing from place to place. It's very hard to put a number on them because they're so transient. But that's also part of the problem. So that 500,000 is that's at one point in time, but there's probably 3 times that many people who spend some time homeless every year over the course of a whole year. So what that points out, and it's important to know, is that people are coming in and out of homelessness all the time. Some people stay homeless for long periods of time. Other people become homeless, stay homeless for a while, and then either through the work of homeless programs or through their own efforts manage to get themselves housed again. You can see there are certain groups are overrepresented among the homeless population. It starts with people with extremely low income. People who are homeless tend to be the people with the lowest income in the community. People who are Black or Native American or Latinx are overrepresented among the homeless population. People with disabilities, particularly behavioral health problems like mental illness and addiction, are overrepresented among the homeless population. Young children are, of course, very likely to be homeless. LGBTQ people are more likely to be homeless, especially younger people, for a range of different reasons. Let's see, next slide. In terms of federal policy to combat homelessness, there's sort of two big things that we need to do, that both federal policy needs to do and local communities need to do to combat homelessness. One is to have a crisis response system that will, when people lose their housing and become homeless, the system will find those people, keep them safe, and then quickly get them back into some kind of housing. And that's, when you hear about the homeless programs or the homeless system, that's its primary role. But then the other piece that is definitely part of the homelessness problem and its solutions is the larger issue of housing affordability. If housing was more affordable in communities, people wouldn't be losing their housing and becoming homeless all the time. And when the homeless system sought to get people back into housing, there would be more stable and affordable housing to allow that to happen. So those two things are very much intertwined with each other. Okay, the next slide, again, in terms of federal policy, when I talk about the homeless system trying to get people back into some kind of housing, there's sort of three main program models that exist that the homeless system uses to get people who are homeless into a permanent housing situation. As you note here, the housing subsidy might not be permanent, but it's a place they can live without having any deadline on their leaving there. One is known as diversion. That term has a lot of different uses, but it's mainly, for us, it's really people are about to become homeless. Can we get them sort of at the front door of the shelter and quickly get them back into some sort of housing situation? A lot of times this will involve people living with relatives. Many low-income people live in large households with relatives or friends, and most people consider that to be better than being homeless. Most of the people experiencing those sorts of situations, they're not great, but they're better than being homeless. So that's one kind of intervention. Rapid rehousing is another kind of intervention that's been growing over the last few years. That's about helping people quickly find a landlord who will rent to them, helping with a temporary rent subsidy to get them into the apartment, and then backing that up with services that are usually focused on helping people get a job so they can afford the rent in the long run themselves. And then finally, permanent supportive housing is housing that's more targeted for people with severe long-term disabilities who need not only help paying the rent, but also help with dealing with behavioral health problems or other kinds of severe health problems. So permanent supportive housing combines a more or less permanent rent subsidy with intensive social services, much of it having to do with health care. And so providing those three interventions as ways to get people out of homelessness into housing is a major part of federal policy. Some of the programs that exist in the federal government, HUD, of course, has homelessness programs. The first bullet is the targeted homeless programs, the continuum of care, and the emergency solutions grants, or ESG. These are in appropriations bills and spending bills. These two are clumped together under what's called the Homeless Assistance Grants Appropriations Account. One thing I would note, since this is a call for community development practitioners, many times the HUD homeless programs are in the part of HUD that administers the community development programs. Distribute CDBG grants, other things like that. So that in many places, it's the community development agencies in a local government that are sort of running the homeless programs for the local government, and that people often wonder, like, how did that come about? And that's how it came about. It sort of mimics the HUD system. So the HUD programs are these homeless programs, and then of course HUD has a range of housing programs, all of which are important to the larger issue of how we can make housing more affordable so that people don't become homeless so often. Also, many communities use the HUD, what we in the homeless world called mainstream programs, not targeted homeless programs. They use some of those, like the voucher program. Some of the vouchers will be specifically used for people who are homeless to get them out of homelessness if they need a permanent rent subsidy. That's a decision that's made at the local level. And we'll talk more about that in a minute. The next slide, the HUD homeless assistance, I want to talk about that because the continuum of care program is in many ways drives what's going on with homelessness in many communities. It's funded at a little over $2.6 billion in fiscal 19. About $1.6 billion of that is to pay for ongoing rent payments for permanent supportive housing projects for people who used to be homeless but aren't anymore because they've been housed in these permanent supportive housing programs. So that renewing those ongoing long-term rent subsidies is what most of the money every year goes for, and leaving about $1 billion left to provide services to people who are newly homeless. That's an important thing to remember when we talk about some of the numbers. The homeless programs are widely thought of on Capitol Hill and elsewhere as effectively addressing the problem. If the problem isn't solved already, it's because there's not enough money in the programs, but the programs have a good reputation, and it's a competitive program from HUD, so people at the local level really have to show that they're getting good outcomes and good results. And as a result, they do get good outcomes and good results. Many, many places find that their homeless programs are very effective at quickly moving large numbers of people off the streets and out of shelters and back into housing. I mentioned before, like most of the funding for the HUD homeless assistance goes to pay for permanent supportive housing payments. That's because there was a period in the early zeros, in the early years, the Reagan administration, where they had a real push to fund more permanent supportive housing, and they decided to do it through the homeless programs. So renewing these programs continues. More recently, a lot of the new permanent supportive housing for homeless people has come through the Housing Choice Voucher, the Section 8 program administered by housing authorities. Just because the finances of it work better and the housing authorities are good at administering those programs. So that's just something to know about the way these programs work. And at the federal level, you know, things like the HUD VASH program, which we'll talk about in a minute, or people are familiar with the 811 mainstream vouchers for people with disabilities that have been part of what Congress made available the last couple of years. Those are very helpful in addressing homelessness, but they don't come through the homelessness program, so they come through the regular Section 8 program. Okay, and then next slide, this is unfortunately a lot of alphabet soup there, but just to show there are other homelessness programs in other departments besides HUD. The Department of Veterans Affairs has a whole range of homelessness programs targeted for homeless veterans. The HUD VASH program, people are familiar with HUD VA supportive housing program, provides permanent supportive housing. HUD pays for a rental voucher. The VA pays for health services. VA also has a program called SSVF, the Supportive Services for Veteran Families program, which is a not very aptly named program. It's not very descriptive, but it's a very good source for the rapid rehousing intervention for homeless veterans and is having very good impacts there. The Department of Health and Human Services has a Healthcare for the Homeless program that funds local health centers that target homeless people. The Substance Abuse and Mental Health Services Agency has grants to provide mental health and substance abuse services to people who are homeless. There's a runaway and homeless youth program that funds shelters and transitional housing, temporary housing programs for homeless youth. And then I put Medicaid and TANF up there. Those are not targeted homeless programs. Those are large mainstream programs, but they've been used very effectively in coordination with some of the homeless programs to provide medical services and a range of things you might not instantly think of as medical services, but the things that people with medical problems need in order to stay housed. And then the TANF program is temporary assistance for needy families. That program has been used a lot to provide services for homeless families with kids. Department of Education has a program to help make sure that homeless children go to school. The Department of Labor has a program for homeless veterans that's about helping homeless veterans get jobs. So those are the other agencies' programs. Next slide. The biggest issue for both the crisis response and the housing affordability problem is getting things funded closer to scale. So for the crisis response part of this, for the targeted homeless programs, one bill is this bill that Maxine Waters introduced, and now Kamala Harris has introduced an identical bill in the Senate. It would provide substantial new money targeted to continuums of care for homeless programs. This gives you an idea of what taking the homeless programs to scale would look like. And it's one proposal to do so. And then taking the larger housing affordability project to scale is, of course, a much bigger issue. But for the first time in a long time, we have a number of members of Congress have introduced bills that are comprehensive attempts to fund solutions to the affordable housing problem through the National Housing Trust Fund, through large increases in the Section 8 program. Many of the presidential candidates have proposals to do this kind of work. So it's very positive looking into the future that we'll get a lot more attention to the affordable housing problem, which will be a great help in ending homelessness and which will be a great help in solving a number of other programs as well. Okay, so let me stop there and turn it over, and I'll be back in a minute, or in more than a minute, but in a short time. Thanks.
Awesome. So my name is Tanya Torno. In case any of you joined in late, I have the privilege of working under the Housing Authority of the County of Riverside, and I'm going to spend some time talking to you about some of our initiatives that we have launched at a local level with a lot of the different funding sources, which Steve highlighted only a few minutes ago. I wanted to start off by just giving you an overview of where we are in the world. Riverside County is located in California. We have a population of 2.4 million, and the area, the land area is in square miles is 7,207. We have 28 cities within our county. We are the 10th most populous county in the United States and the 4th largest county in California by area. At a glance, I just wanted to provide an overview of the Housing Authority's mission, which, like many other public housing agencies in your community, whether county or city, really rests on the idea of providing low-income housing and doing that in a way that reignites hope and restores human dignity. We do that through the creation of new affordable housing and the administration of housing assistance programs. In Riverside County, the Housing Authority is comprised of our public housing agency, so the Housing Authority of the County of Riverside, but it also includes our housing division, which is responsible for the administration of county home dollars that are critical in the development of new affordable housing that we have also used to develop additional rental assistance programs. Some of you may be familiar or have heard of the term tenant-based rental assistance, which is similar to rapid rehousing in that it can provide up to 12 to 24 months of rental assistance to low-income households. So it's just an additional resource and tool that we've been able to use to prevent homelessness or combat homelessness. I really wanted to take some time to highlight some of the accomplishments but before jumping into looking more closely at sort of the main programs that we've been able to utilize to help end homelessness. In May 2013, our local Board of Supervisors approved the VALOR initiative, and VALOR stands for Veteran Assistance Leadership of Riverside County. And basically this was an initiative to ensure that no veterans were left behind and ensured that every county department looked for creative ways to prioritize veterans to the different services that they administer. And so for housing, being a housing agency, along with working with our continuum of care lead, which in Riverside County is our Department of Public Social Services, and so utilizing the continuum of care funding, which Stephen was talking about, those two agencies, along with our Riverside County Department of Behavioral Health and other agencies that administer housing assistance programs, utilized those programs and to prioritize homeless veterans and their families. And I'll talk a little bit more about how we were able in 2017 to become the first large county in the nation to end homelessness among veterans through the achievement of what's known as functional zero. In 2013, I just wanted to give some perspective to when the VALOR initiative first started. There were 285 homeless veterans identified in Riverside County through our annual homeless point in time count. And the annual homeless point in time count is a day where communities come together to count the unsheltered and sheltered individuals in their community. We know that we use volunteers to assist with the count. They participate in training, and there's a survey that's used to help measure or capture basic information about demographic information about the individuals that are interviewed that day. I will say that most communities would probably say that you can multiply, the results of the count by 2 or 3 to get a more accurate reflection, because it's truly difficult for any community to get a true count of how many people are homeless. Within 100 days of launching our VALOR initiative, we were able to house 140 homeless veterans using continuum of care funding, again, administered through our Department of Public Behavioral Health and the Housing Authority. Since then, and to date, and I need to update this slide, we've been able to connect over 1,800 homeless veterans to housing, so from 2013 until today. The next slide really just provides an overview of some of the housing resources that were utilized for that effort. Steve spent some time talking about housing choice vouchers, and I know he also mentioned VASH, and so I just wanted to include the allocation of VASH vouchers in Riverside County. So you can see that we have 589 VASH vouchers earmarked in Riverside County. In addition to VASH tenant-based vouchers, where participants can take that voucher and utilize that at a private rental unit of their choice, we also work and partner with developers in that are interested in developing new affordable housing across the 28 cities in our county to build affordable housing projects, and we've been able to basically reserve some of those units specifically for homeless veterans who are eligible for VASH. These are key because the moment that a veteran graduates from the program and exits the unit, that unit is still reserved and can be utilized for a new veteran who is entering homelessness. I won't go into detail too much about the other resources, but I just would definitely play in that housing choice vouchers, so the use of Section 8 vouchers, and leveraging those with some of the rapid rehousing and permanent supportive housing resources available through our continuum of care have been critical, or were critical, in us ending veteran homelessness. And another critical piece is, we were able to successfully launch our coordinated entry system, and essentially, this is a system that brings together all of the different public, private, and community-based organizations within a community and that are working to address homelessness, and allows for the use of a universal assessment tool so that as individuals are engaged by a homeless outreach worker, they participate in a universal assessment and they're entered onto a by name list, and they're prioritized by their chronic homeless status or by their length of homelessness and their acuity. And the idea is really, we really look at mirroring the emergency hospital model, in that the people that have the most acute needs are going to be connected to housing first. And the universal assessment tool has also been instrumental in helping us triage referrals so that we can determine which clients would benefit from a rapid rehousing program that provides short-term, medium-term rental assistance. So the idea is that the subsidy is going to end normally within a 12 to 24-month period. And then those that require permanent supportive housing, who maybe have more acute needs, are disabled on a fixed income and will require longer-term support. So their assistance is going to be ongoing, and they're going to be receiving a more intensive type of wraparound care by housing providers, again, over a longer period of time. So overall keys to Riverside County success in reaching functional zero, definitely due to our leadership, our Board of Supervisors recognizing that no veteran and their families should experience homelessness, the successful launch of a coordinated entry system, the coordination of public and community-based mobile outreach teams. So we have now gotten to a place, because of VALOR, where we have been able to strategically map out which outreach teams are covering different parts of the county. And again, because of our coordinated entry system, we can now, we now participate in regular case conferencing where we can have conversations about specific clients and their path to exiting homelessness. I think another essential component is that we've been able to leverage all different streams of funding, whether state, local, federal, to be able to look at creative ways to utilize that funding, either to implement rapid rehousing, permanent supportive housing programs, but also look at ways that we can utilize that to implement bridge housing, so temporary housing that could be used to help place an individual or a family into a safe setting until they can bridge or jump into a more permanent housing plan. We've also, through VALOR, we won't take credit and say that we developed the term housing navigators, but at that point, we recognized that outreach played a critical role in engaging and identifying and connecting individuals who were unsheltered to the services that they needed and helping them get their housing docs, that we really needed sort of a special group to help with the landlord recruitment piece, people that had real estate experience and could go out and build up those partnerships. Because again, what we've learned is you can have all the housing resources in the world, or you can have funds to pay for rental assistance, but if you don't have landlords, if you don't have units, then those individuals are not going to go anywhere. They're going to stay on the street until you can find them a place that is willing to take that voucher. So what lies ahead? Where are we now? In 2019, our point in time count revealed that we had a 21% increase from 2018. You can see from the slide that we have 2,800 individuals who are sheltered in emergency shelters or in an unsheltered setting in Riverside County. We're working very closely with Community Solutions and the Build for Zero initiative to continue to sustain our functional zero in veteran homelessness. So now that we've accomplished that goal and we've been able to demonstrate that we have a coordinated and efficient community system through our coordinated entry system that I talked about earlier to ensure that homelessness is rare and brief for veterans, we need to make sure that we're able to sustain that, and that as new veterans enter homelessness, we continue to have a pipeline to get them out of homelessness as quickly as possible. We're also working to end chronic homelessness. We had an 8% increase from 2018 to 2019, and again, are engaging with Community Solutions and Built for Zero to work on closely monitoring our data through our by name list, so that we can continue to prioritize those individuals. And locally, we have also really have started to take an emphasis on the amount of seniors that are experiencing homelessness in our community. This is brand new. I will say it's something that was revealed shortly after the point in time count in January, where we saw that we had a 16% increase from 2018. So we are looking at ways that we can also prioritize local resources and work with other departments like Office of Aging or Adult Protective Services to target that group. Again, moving forward, where we are headed, or what the things that we're doing in order to be able to accomplish those goals that I talked about. In 2018, we put together an action plan that consisted of 21 strategies to end homelessness. In that strategy, one of those strategies included the appointment of a director of homeless solutions that works out of our executive office to coordinate the collaboration amongst county departments, but also with cities and other nonprofit stakeholders. The executive office has been working closely with county departments, and with that I will stress it's with our continuum of care to better understand spending on homeless-related issues. So all county departments moving forward are required to set special codes on time cards so that at the end of each year we can report, you know, the total cost towards homelessness. And this is critical, again, because traditionally, you know, agencies like the Housing Authority, Behavioral Health, and our Department of Public Social Services have always done this. But as we, you know, have started to have homeless conversations with other departments, we know that first responders tend to be law enforcement, code enforcement, even flood control or animal services. A lot of times they're called to respond to situations that involve individuals who are experiencing homelessness. So we want to, again, get a full picture of what is this truly costing us, so that we can be able to advocate, you know, for additional funding, but then also look at sort of our county general fund and say, if we're spending this much money, could we do a cost savings by maybe, you know, doing a general allocation? That's actually just my idea. But anyway, you know, I just trying to get an understanding of what that looks like. System coordination is huge, and we've been very fortunate that the state of California has been dedicating money to help fund initiatives to coordinate discharge planning from homeless patients released from hospitals and inmates released from jail. I won't go too much into detail, but we successfully implemented a whole person care program that provides services to probationers who are being released, and allows them to be screened by public health nurses and connected to social services and substance use and housing. In addition, we've been able to continue to earmark vouchers through our Housing Choice Voucher Program, so that we can create things like a Moving On initiative and partner with cities who are committed to prioritizing and supporting homeless referrals, so that cities are funding the first 12 months of assistance, and the Housing Authority will provide a Section 8 voucher on the 13th month. So it's just a creative way to create additional permanent housing, permanent supportive housing beds by leveraging and mixing dollars. Housing resources, again, I just want to give kudos to the state of California, Governor Newsom, because they have dedicated a lot of resources to create new housing. I just included a slide with some of the new beds that we've been able to create through this. The only one I will draw attention to is that earlier this year we were notified that we were one of the top counties in California to receive the highest allocation for No Place Like Home. This is state funding that was set aside for the development of permanent supportive housing. And so through that, we're going to be able to create a total of 257 permanent supportive housing units for individuals who have chronic behavioral health conditions. In addition, we have also taken advantage of additional funding available through the state for supportive services. Housing, connecting individuals to housing is key, but we know that that's not the end-all. Supportive services are critical, and so there is a new health home program in California which coordinates care for people with Medicaid who have chronic health conditions, and it's currently being administered through our Riverside University Health System community health centers which has been essential. It doesn't specifically target homeless individuals, but you can imagine that it definitely includes this group, since a lot of individuals that are homeless, end up in emergency rooms and are high utilizers. In addition, I just included a point about our workforce development department, in that they too have set aside a special initiative and have enrolled 56 homeless individuals to services, into workforce-related support services to help them gain or regain self-sufficiency. Because of timing, I won't be able to go too much into detail, but I did include some additional slides on an encampment response that we've been able to launch in Riverside County. We're mirroring our emergency management department model in order to effectively coordinate those services. In addition, we're looking at ways to utilize technology to help track and manage the way we respond to homelessness. And finally, keys overall to Riverside County's success really, again, comes around our ability to leverage the different pots of funding that we get, and look to our landlords and developers for partnerships in order to create new housing, new additional housing resources for those that are in crisis. And I will end there and hand it, I believe, back to Steve.
Steve, if you have, just I know you have to up soon, so.
Yeah, I'm here.
Great.
Okay, so I want to spend 2 minutes on some key things in Congress. This is not everything we're talking about, but as people know, the annual spending bills for federal programs are working their way through Congress slowly, but hopefully surely. And we at the National Alliance to End Homelessness have been concentrating on the spending for HUD's homeless assistance, which, as I said, is the name of the spending account that includes both the Continuum of Care program and the Emergency Solutions program. You can see that both the House and the Senate bills include modest increases for these programs. We're seeking a little bit more than modest increase because we feel like that the programs have demonstrated that they can get great results. And I think what we just heard about what's happening in Riverside is a good example of that. A lot of that focuses on veterans, which, as I said before, there are separate VA programs for homeless veterans. But I think the work that's been done by communities really provides a model for what could be happening with everybody if we could make sure that the funding was sufficient. So so our ask is to increase this line to $3 billion from the $2.636 billion. We'll see how that goes. And then the next slide shows a number of other sort of important things that are going to be maybe happening the rest of this year. Of course, we talked about other HUD programs. One of the key disagreements right now over these spending bills is like how much money should be spent overall for HUD. It's not something that is in the papers a lot that's a key disagreement, but that is one of the key issues. So the SSVF program is, as I said, one of the VA programs, the Veterans Affairs programs that provides rapid rehousing funding for homeless veterans. That program has been very effective and could use a boost in funding. And then I listed 4 different, what I consider to be relatively small, bipartisan. Well, one of them isn't so bipartisan, but the first 3 are bipartisan. The last one isn't, but it's very important, that are that have been introduced are working their way through the process and people should know about. You can contact us or look at our website to get more information about this. The first one is just expand eligibility for HUD-VASH. There are certain homeless veterans who aren't eligible because of complicated VA rules about who's eligible for health services, and this bill would expand the eligibility so that a greater number of homeless veterans would be eligible for HUD-VASH. Tribal COC eligibility. Right now, Indian tribes are not eligible to receive funding through the Continuum of Care program, even though Native Americans are a group that is highly overrepresented in homelessness, and we think making tribes eligible to compete for these programs would help with that. The Fostering Independence Act is a bill in the House that would make more housing choice vouchers available to young people who are aging out of the foster care system. This is a group that has very high rates of homelessness. Typically about a quarter of the young people who age out of the child welfare system or foster care system become homeless within the first year that they're out, and this would make some vouchers available to them. And then finally, transgender people their rights are protected in HUD-funded homeless shelters right now. HUD has been talking about changing the rules for homeless shelters to allow homeless shelters to either preclude trans people completely or to make them use facilities according to what somebody else thinks their gender is rather than what they think their gender is. There's provisions in the appropriations bills that would stop that from happening, and then there's this separate bill that would stop that from happening. That's something that's moving forward. There's proposed regulations that may come out. The rule right now is good. It's proven very workable for people running shelters. There may be an effort to change the rule, who knows, and there's legislation to stop that. So that is it for me. So I think we're ready for questions, right?
Yeah, perfect. Let me get the final slide up. Sweet. So thank you both for the that wonderful presentation. Here we go. Great. So I'd like to just start with one question that has come up that maybe both of you can tag team, and Steve, if you have to hop off, we can focus our questions at the local level with Tanya. But can y'all talk about the recent increase in rapid rehousing efforts that you talked about, Steve, and where that shift came from and what was happening beforehand, and then maybe the benefits, why that's been such an effective way to address homelessness.
Yeah, I think there's two things happening. One is just there's more funding has been made available for programs that fund this rapid rehousing intervention. As the intervention has become much more popular, people have learned more about it. You come to our conferences, we've been doing training about it, and people start implementing this. They see, oh, this really works. It's really good it really works to get people out. A lot of people, once they get out of homelessness, even if they're not working when they're homeless, they get in their own apartment and they have a few months of the rent being paid, and they quickly find once their lives are stabilized a little bit, they can get a job and they can afford the rent on the long-term basis. But another thing is through the continuum of care competition, communities have been really pushed to replace programs that have not gotten the greatest results. In other words, for the amount of money they're spending, they're not moving a lot of people from homelessness into housing. To replace those with programs that are going to move more people into housing. That's known as the reallocation process if people are involved in the continuum of care applications. So HUD has been incentivizing people to use more programs that are more about sort of getting those rapid results. So that's been pushing it as well, I think.
Great. So far as Steve, I think you did a great job outlining that there are also subpopulations within the homeless population that are disproportionately impacted and experience homelessness at higher rates. And so I guess this is for Tanya at the local level with the conversation on outreach teams. What is that process of engaging these different kind of subgroups within the folks who are experiencing homelessness look like, and has that how has that been, has there had to be any like sensitivity trainings? What does that look like on the ground?
Oh yeah, so I will say that we are fortunate within our continuum of care within our county to have homeless service providers that, while some definitely serve the general population, we also have those that specialize in serving youth, that specialize in serving veterans, or those that, behavioral health, for example, prioritizes those that have mental health and substance use challenges. Just recently, because of the results of our point-in-time count and seeing the increase among our senior population, our Adult Protective Services unit actually developed an outreach team to target that population. We're very much a county that is following our data and is making decisions on how to most effectively, efficiently coordinate those resources, and we see the value in providing targeted outreach and having training staff to target, and become sort of experts in targeting specific groups. And so within those groups, you definitely see specialized training, kind of overall the general trainings that all of our outreach teams participate. And a lot of these trainings are facilitated at the county level, and then we just do an open invite to all of our partners, include topics in motivational interviewing, harm reduction, cognitive behavioral therapy, sensitivity training that really just focuses on making sure that the initial engagement, and actually at all times, at all levels of engagement, that staff are doing engagement in a non-judgmental, confrontational way that doesn't force an individual to engage in services, but a lot of the times really just begins with a casual conversation, in which the outreach worker will go out and, offer the individual water, coffee, or, if they notice that the individual has a injury, or has I think I'll use the pet as an example, but looks at ways to sort of create incentives or utilize services as incentives to help build rapport.
Great. Thanks for that. And look, we're coming up at the end of our time, so there are a number of other questions here that hopefully folks will be able to reach out to you and Steve with. I also have a number of questions I would love to follow up on. So this was a really insightful conversation. We all really appreciate it, and the work that you all out in Riverside are doing has been wonderful, and is definitely an awesome model for other counties across the nation to look to. So thank you, Tanya, for your time, and Steve, thank you for yours. And everybody else, thank you also for spending the afternoon with us here this wonderful Halloween day. So just before we get off, we the Restoring Neighborhoods webinar series focuses on good examples of community development related work. So in the case here, Riverside Ending Veterans Homelessness, which is incredible work being done. If you know of work that's being done, or your organization is doing work that you think is in this similar vein, or thinks that we should be paying more attention to, please let me know. We love to hear from everyone who's tuning in to hear about the work that everyone's doing. So with that, I'm going to finish up the webinar, and thank you all one more time, and hope that everybody has a happy Halloween. Thanks, y'all.